Andy Austin here. Quick video on PSACS, that is physiological state accessing cues. Now this is a part of IEMT that is not always taught. I think some trainers tend to miss it. It's quite an important thing, but because of the nature of it, people tend to overlook it. So I thought, okay, let's do a video explaining the importance. My dog is just running away. Right, Wilson. Wilson, come back. So because of the nature of these things, it's like, well, what do I do with it? If I'm a therapist, surely I just get them to think about the situation, the problem, and tell them to move their eyes. I mean, what more do I need to do? Now, this is an ongoing frustration for me personally, because so many therapists and coaches and practitioners of all descriptions across all disciplines, IEMT, NLP, EFT, it doesn't really matter what it is, they reduce everything down to techniques. Psychiatry did the same thing. Psychiatry just became, okay, which drug do I give the person? What drug will do the job for me? And alternative practitioners who don't believe in drugging people, they just replace diagnostic criteria and medication with techniques. So instead of thinking, okay, what drug do I give that guy? They go, what technique do I give that guy? And they prescribe techniques, which they then deliver with great aplomb and Facebook boasts and all the rest. It's quite frustrating if you're me in watching people do this. I'll just show you where I'm actually. I'm just fascinated by these pylons. They remind me of, do you remember the tripods? There was a children's TV series. And I always think of these things. I remember the tripods. We can't reduce everything down to techniques. We have to pay attention, and it's a word, I hate this word, holistic. We have to think holistically when we're looking at the person sitting in front of us. Because the problem doesn't just reside in a picture they make in their head, and that when we get them to move their eyes and the picture gets further away, it reduces focus, kinesthetics reduce, they age progress. Suffering goes deeper than that. A lot of the NLP practitioners make the same mistake. They seem to think that you can just reframe something, 6-step something, and all suffering and difficulty and mental health issues disappear. Well, just look at them. Clearly that's not the case at all. Wilson, come here. Come here. Come here. Now, when I trained as a nurse, the word holistic, we had to view treatment and therapy and patient care holistically. We would see the whole patient, not just the symptom. The patient is more than just the broken leg. They're a whole person with spiritual, philosophical, psychological, emotional, and social needs. And so we would have to pay attention to that. I could never quite understand why, if all that we're doing is treating a broken leg. So there's a bit of a paradox here. We can look at people holistically, look at the whole person, and say that, okay, we shouldn't really just be doing a simple technique to try and get the person to be better in their life. Yeah, at the same time, I deride people who reduce everything to techniques. But what's the point in doing techniques if all we're doing is fixing the broken leg, metaphorically speaking, if that makes any sense at all? This is where the physiological state accessing cues, PSACS, comes in. What we're able to do is when we're looking at how people behave, how they gesture, the movements they make, their flow, physiologically flowing through states, you can track, predict, and time how long states are there for. When you get good at this, basically you know what you're looking at. You're not having to ask endless questions to find out what's going on. The example I use when I teach IEMT is of the patient in a group therapy session. He's sitting in a circle with all the other schizophrenics and depressives, and his head's in his hands, and he's wailing, he's bashing his head in frustration, and this is pretty much how he spends his day. And the therapist says, would you like to begin the session by explaining to people how you feel? Which bit of that needed to be explained to people? But clearly to that particular clinician, and this was a real example I saw firsthand, clearly that therapist was not paying attention to what was being communicated non-verbally. We tend to rely too much on people communicating their suffering verbally to us in a way that we can understand, so we can take their linguistic references of their suffering and place it into the categories by which we have trained in order to understand them. Well, you're fully trained as a human being, hopefully. you're able to see what people are experiencing, you're able to see what people are feeling, you're able to see what people are non-verbally communicating. But it's as if people don't spot those things and see those things unless they've gone on a course to teach them how to do it. But you've been doing it your entire life. We all have. We all do this stuff. So the physiological state accessing is basically watch the body, watch what does the body do. Now, if you look at Stanislavski, the Russian guy who basically developed method acting, I bought all of his books. So I thought they'll be useful read. And written in old Russian and then translated to English, they're basically unreadable for the likes of me. But reading the books about Stanislavski, he was largely, you access the identity of the character you're becoming, and you do that physiologically. I've just got to retrieve my dog again. With the Stanislavski method, we don't just start pretending to be the character that we're going to become. The method largely involves massive amounts of muscular relaxation, and this is possibly the hardest part for people to do. It's to totally relax every single muscle in the body, and first, before we can do that, we have to identify both the muscle and the tension that we have. And the residual tension that people hold in their body is quite remarkable. I'd found this myself through doing similar things within yoga and meditational practice, where essentially you're tracking every muscle group that you can find. Tense it, relax it, tense it, relax it. And just when I would think I couldn't possibly be more relaxed in my muscles, I would then identify something, and it would be a huge thing, and I would relax that, and I feel a wave of relaxation come as a result of that. That's always been there. That's a background level of tension that I've just habituated to, and this is what we find with people. A lot of those muscular tensions, of course, have a sequence to them which gives rise to a non-verbal communication. Those kind of things. With Stanislavski, he would get people to be completely relaxed. He'd pick up an arm and it would just drop as a dead weight. Then the person starts to mold themselves physiologically into the character they're becoming, and they basically assume the physicality, the physiological aspects and tensions of the person that they are turning into. I've never done new code NLP training, but I'm aware that there's aspects of this within new code NLP as well, which is the micromuscular movements, micromuscular tensions in order to track certain physiological stuff. We tend to generally only follow the big non-verbal communications, the gestures that we make, the expressions that we pull, the postures that we assume. But of course we can reduce it down ever smaller to individual muscular tensions, some of which of course we can't even see, because they either happen so fast or they're at such a micro level. And that's where we now have the lie, I can't even remember the guy's name now, Paul Ekman's work, where essentially you have to slow down the video footage of the person to detect the muscular movement that occurred. So this is really the basis of the physiological state accessing cues, is to become aware of the non-verbal stuff and track what's actually happening with the patient. Why is this important? People lie. People will say what they need to say to please the practitioner. And this is a well-documented phenomenon within therapy generically, which is the client is eager to please the therapist, more so than they are seeking change. And this is quite a common phenomenon. I suspect the more money you charge people, the less likely that is to occur. But I think it's still going to be there anyway, because we're social creatures and we try and make a good impression. So within the holistic view that I have of working with people with IEMT, what I'm tracking is, okay, so we ask the person, do they have a problem, a feeling that's brought them here today? Yeah, of course they do. And then we do the basic pattern, we reduce it down to a score out of 10, and then we track it back to an early imprinting memory, and then we move the eyes around the imprint. I'm looking for what happens as we do that. A question came up on one of the forums this week, which was somebody's been working with a client, and since working with them, they've reported headache, nausea, lots of the classic dizziness type symptoms that people can report. What do I do? And I'm thinking, well, what did you do to begin with? Not what should I do now, what did you do in the first place? That is really where my attention goes first. Two things here. Possibly they were going like this for 20 minutes, half an hour, 2 hours, instead of 20 to 40 seconds maximum. So that's quite a common thing that's happening. But what were they doing? What was the client doing physiologically while they were moving their eyes? What other information could have been gathered about what's happening for that person? That when we done the first round, so we start off with a score out of 10, how familiar, how vivid, when's the first time, how vivid, whatever. And then we re-measure. So when you think about the memory now, what happens, and when you think about the feeling now, what happens, how strong is it out of 10? You should already know that. In theory, if you're paying attention, you can already see whether the feeling has improved, their state has improved, or if they're in a worse position. Now, are you able to pace and lead this? So if the person is looking distressed, rather than ask them, oh, so how are you feeling now? Is it any better now? Well, clearly the person's distressed. They're looking like, they're going to puke. We can now go, okay, so you look like you're going to puke, and you're not looking too happy. And so when we reduce that particular memory, this happens. Now, because we've reduced that memory, this happens. Look at what's happening with the body. Why does reducing that memory in that way produce this nausea? That's something that needs to be considered. Because sometimes, you see, it's easier to focus on the problem that's not actually a problem. No, I'm not angry with you. I'm just tired at the moment. And now I can convince myself I'm just a bit tired instead of being angry with you. We do those kind of things all the time. We substitute, we sublimate, we change our focus of what's actually the problem to something else that's much more easier to deal with, it's more socially acceptable, it has less consequence. And so we can bury the stuff that really bothers us. If somebody feels sick, what are they feeling sick about? I mean, I get sick of things myself. I can start to play it into the metaphors type work, the other stuff. There's lots of other methodologies we could use. My thinking is this: if the client's leaving the room with those symptoms, we need to see those symptoms before. They were there, it's just the person wasn't necessarily looking for them because they're paying attention to the verbal reporting of what the client says in answer to the questions being asked. And quite often those clients will lie and say they're actually feeling fine, when clearly they're demonstrating something else. So now here's some other stuff you can do with these PSACS, these physiological state accessing cues. How do you access good states? How do you access bad states? And track how you do that. Now, Joseph Riggio, who was on the Society of NLP scene, he produced a model called MythoSelf, or mythogenic process, MythoSelf. I'll put a link below. Now, part of the MythoSelf process looks very much about how do you know when you're in a peak state. Because you have to access the physiology of it. There's an imprint of what that peak state is like physiologically. And so a large part of that training is how do you access it, and how do you find those peak states for yourself, so you can basically now consciously access into them. And that's a pretty good thing, I think. Within the PSAC model, the physiological state accessing cues, we can start to do the same thing. But I'm watching for what happens when the client might laugh, they might release tension from the work that we're doing. They clearly have just had a shift, and then they go out of that into something else that's negative. So I'm tracking that. And now what I'm going to do is I'm going to break tension, get them to laugh, get them to a positive state, and I'm going to track it again. Let's see what happens. So are you following the same physiological patterns to access into it? Now what I can do, of course, once I've got the model of how they're doing it, I can interrupt it. I can remind them to, just sit back for a moment. Don't let your coffee get cold. I could hand them something. I can interrupt their state accessing to a negative if I need to, or if I can use that therapeutically to the client's advantage. The other thing I can do, of course, is I can encourage them to do more of the positive stuff, less of the negative stuff. I could draw conscious awareness to certain things. And certainly in the IEMT training, this is one of the things that we do. Although when I've taught this, I've never really made it too obvious as to why do we insult the patient? Why do we insult the client when they rub their thigh in that way? Well, we're attaching a taboo to that gesture. So we're incapacitating their ability to accidentally enter into the negative state, because what we've got them to do, of course, is by giving them a taboo and anchoring that to that particular gesture, we've now got a pattern interrupt. So I could use those methods as well. Essentially what I'm going to do, as well as resolving historical data that they're carrying around in their limbic system, in their brains, I'm also dealing with the feed forward aspects too. So the feed forward is how I re-access those states and re-engage the physiology, re-engage the kinesthetics, and now re-engage the behaviors that go with those as I go about the world and interacting with other people. So this is a feed forward process that I'm now dealing with. I've worked with the historical data of their past traumas, but now what I want to do is to start to interfere with their ability to feed forward the remnants of these things through their enculturated behaviors into their future patterns. So that's largely the purpose of why I would do this. It's not just to randomly insult people. It's not just to be oh so clever because oh aren't I witty. That's not what it's about. It's about changing the sequence by which the person re-engages the problems from days of old. Because remember, people's suffering goes deeper than just a few pictures they make in their head. It goes deeper than a few internal dialogue phrases that they have inside their heads. It's distributed throughout the whole system. The whole physiology has been shaped by that trauma, by those events in their lives. So we're trying to change both the historical record of it, the data bank that informs them to be this way, to remind them to be this way. And then we're also now changing the physiological, the body at not cellular level really, but at a muscular level, their ability to feed it forward. So that's the purpose of PSACS. Comment section below. Click the like button, by the way. That's always useful for me. And please do ask any questions, because I'll be doing more videos like this as well. So use the comment section, click the like and subscribe. I'm getting good at this YouTube stuff. And I'll see you in the next video.